How do you interpret your liver screening results? Imagine getting a set of blood test results and wondering what they really mean for your health. Liver screening is a vital part of keeping your liver healthy and catching problems early, especially since liver disease can develop quietly. But understanding what your results say requires some context and guidance from healthcare professionals. Liver screening usually involves blood tests called liver function tests or liver enzyme tests. These tests measure levels of enzymes and proteins such as alanine aminotransferase, aspartate aminotransferase, alkaline phosphatase, bilirubin, albumin, and sometimes gamma-glutamyl transferase. These markers help assess how well your liver is working and if there's any damage or inflammation happening. It's important to remember that a single test result doesn't tell the whole story. Your results need to be looked at alongside your medical history, symptoms, and risk factors. For example, a slightly elevated alanine aminotransferase in someone taking medication for cholesterol might not be a concern. But the same result in someone with symptoms or risk factors for liver disease could be more significant. That's why doctors always review your previous results and overall health before making any interpretations. Abnormal results often follow specific patterns that can point to different causes. If your tests show high levels of alanine aminotransferase and aspartate aminotransferase, it might suggest liver cell injury, which can be caused by viral hepatitis, alcohol use, fatty liver disease, or certain medications. If alkaline phosphatase and bilirubin are elevated, it could mean there's an issue with bile flow, possibly from gallstones or bile duct problems. Sometimes, results show a mix of both patterns, indicating more complex issues. The degree of elevation also matters. Mild increases, less than twice the normal limit, can be temporary or benign, while higher levels often need further investigation. If your results come back normal, that's generally a good sign. It suggests your liver is functioning well at that moment. However, normal tests do not completely rule out liver disease. Some conditions, including early cirrhosis or liver cancer, can sometimes be present without abnormal blood tests. That's why screening is just one part of a comprehensive approach to liver health, which includes considering your risk factors and possibly imaging tests. When results are abnormal, your healthcare provider will consider several factors. They'll look at how high the levels are, your medical history, symptoms like jaundice or fatigue, and any medications or supplements you're taking. Mild abnormalities might just need repeat testing after a few weeks. More significant changes could lead to additional blood tests to check for viral hepatitis, autoimmune conditions, or metabolic issues. Imaging tests such as ultrasound, computed tomography, or magnetic resonance imaging might be recommended to examine the liver's structure. If necessary, a specialist called a hepatologist may be involved to help determine the cause and plan treatment. Regular liver screening is especially important for people at higher risk of liver disease and liver cancer. This includes individuals with chronic hepatitis B or C infections, cirrhosis, heavy alcohol use, obesity, or type 2 diabetes. Early detection allows for interventions that can prevent the progression to more serious conditions like liver failure or cancer. For example, treating viral hepatitis can significantly reduce the risk of developing liver cancer. To protect your liver health, it's helpful to know your risk factors and discuss them with your healthcare provider. Follow their advice on follow-up testing if your results are abnormal. Adopting a healthy lifestyle is also key. Maintain a healthy weight, limit alcohol intake, avoid unnecessary medications and supplements, and get vaccinated against hepatitis B if you are at risk. If you have ongoing liver issues, sticking to your treatment plan and attending regular checkups is essential. Remember, liver screening tests are valuable tools but are not perfect. They can sometimes miss early disease, and abnormal results don't always mean serious problems. Always consult your healthcare professional to interpret your results in the context of your overall health. Never try to diagnose or treat yourself based on these tests alone. In the end, understanding your liver screening results involves looking at the numbers, your health history, and your lifestyle. This combined approach helps identify potential problems early and guides appropriate management. Regular screening, especially for those at higher risk, plays a crucial role in preventing liver disease and liver cancer. But it's always part of a broader, personalized healthcare plan designed with your doctor's guidance.